The Tyranny of Metrics, by Jerry Z. Muller. Professor Jerry Z. Muller says today's society has a metric fixation, an obsession with measuring, ostensibly to fuel improvements and publicize the results of their tallies in the name of transparency and accountability. Muller exposes how metrics can mislead and distort, and he details how education, health care, law enforcement, the military, business, finance and nonprofit entities use metrics improperly. Muller makes a compelling case for why you shouldn't substitute measurement for personal experience or sound judgment. GetAbstract recommends his practical insights to executives, policy experts and organization leaders trying to escape the metrics trap. In this summary, you will learn why and how organizations embrace metrics, why a metric fixation can be damaging, and what you can do to make measurements more useful. Takeaways. A metric fixation is the belief that numeric measurement can substitute for experience and personal judgment. Those with a metric fixation believe metrics provide accountability and transparency. Critics say metrics can distort information and encourage people to game the system. Measuring simple, easy things when you want a complex outcome creates distortions. You can cheat or game the system by lowering your standards to increase your numbers, or by omitting or manipulating data to get better results. Creaming, another way to game the system, means taking on only easy clients or cases to increase your success rate. Organizations fall prey to a metric fixation as they grow larger and more complex. Pay for performance. P4P assumes that employees are motivated only by external rewards. A P4P setup can lead to a drop in creativity and to the propensity to cook the books. Always ask what you're measuring, why you're measuring it, and what you plan to do with the information you find. Summary. The argument against metrics. People with a metric fixation claim that exact measurement increases transparency and responsibility. They believe that numerical calculations are an acceptable substitute for personal experience and talent, that publicizing metrics makes institutions more accountable, and that rewards or punishments tied to measured objectives are the most effective motivators. These arguments are mistaken. In fact, a metric fixation can distort information and encourage individuals to game the system. Distortions derive from flaws such as calculating metrics only on things that are easy to measure, measuring simple things when your desired outcome is more complex, quantifying inputs rather than outputs, and degrading information quality through standardization. You can cheat by lowering your standards to increase your numbers, and by omitting or manipulating data to get better results. People also commit gaming through creaming, which means taking easier clients or cases so you have more wins, or excluding challenging assignments that might depress your rate of success. How the metrics fixation evolved. An early instance of pay for performance (P4P) cropped up in Victorian England. In 1862, politician Robert Lowe based funding for schools on students' performance in reading, writing and arithmetic. A school lost government funding for every wrong answer on a test and for every student who was absent. One of Lowe's school inspectors, Matthew Arnold, disputed this approach. In his essay, The Twice Revised Code, Arnold correctly predicted that pupils would learn just enough to pass their exams and that poorer students would skip taking the tests or find other ways to fail. In politics, administration and other fields, numbers are valued precisely because they replace reliance on the subjective, experiment-based judgments of those in power. Organizations fall prey to the metric fixation as they grow larger and more complex. Executives who drift from a company's mission may use metrics to fuel faster decisions. Managers may suffer from complicatedness, in which reporting on their work overtakes doing their work. Those obsessed with metrics demand more data and may be less willing to listen. Meanwhile, IT makes it easy to tabulate results quickly, especially in the form of spreadsheets. There is no silver bullet, no substitute for actually knowing one's subject and one's organization, which is partly a matter of experience and partly a matter of unquantifiable skill. During the 1970s and 1980s, the metric fixation worsened. Businesses focused more on managers and less on shareholders. According to the principal-agent theory, gaps opened between an organization's purpose or mission, and its managers and employees. In the presence of such gaps, principals, executives, had to provide incentives to engage managers and employees. Businesses were the main proponents of the principal-agent theory in the 1970s, but government agencies and nonprofit organizations began adopting it in the 1980s, calling it New Public Management. Under that strategy, those who paid for government agencies such as taxpayers or for nonprofits such as donors were the principals. The agents were the users, such as students, patients or customers. The idea was to make these public institutions run more like a business. But this model may not be appropriate for government agencies and nonprofits, because their mission is service, not profit-making. Mismeasurement in education. Many Americans attend university because college graduates tend to earn more over their lifetimes than high school graduates. But a bachelor's degree doesn't necessarily mean you're better prepared to enter the workforce or that you'll be more productive. Some jobs that formerly required only a high school diploma now demand a college degree because employers want it, not because the work has gotten harder. Gaming the metrics occurs in every realm, in policing, in primary, secondary, and higher education, in medicine, in nonprofit organizations, and, of course, in business. Many U.S. high school graduates aren't prepared for the academic rigor of college. They take standardized tests, such as the SAT and ACT, which claim to gauge their college preparedness. The ACT assesses students in English, math, reading and science, but 1/3 of recent test takers did not meet the criteria for university-level academic success in any of these disciplines, and only 38% met the benchmarks in at least 3 of the 4 areas. Because many incoming students aren't ready, they must take remedial courses when they start college before they can begin their core classes. Colleges lower their standards because they want as many students as possible to graduate, and graduation rates partly determine university rankings. Students take easy, remedial classes, and schools pressure professors to give higher grades. Colleges with low graduation rates lose prospective students. We tend to assume that performance and transparency rise and fall together. But that is a fallacy or at least a misleading generalization. The U.S. Department of Education is behind many of the metrics used in American education. In September 2015, during President Barack Obama's administration, the department developed a college scorecard tying federal funding to ratings. The government graded and ranked colleges based on access, affordability and outcomes for all students, regardless of gender, race, ethnicity or other divisions. The idea was to weed out for-profit schools with high tuition and low graduation rates, and to demand more accountability from traditional colleges and universities. Reward based on measured performance tends to promote not cooperation but competition. Easier access for low-income students, who especially lack preparation for college, typically means lower graduation rates. Schools game the system by raising their admission standards or restricting applicant access. Standardized testing leads to creaming, in which colleges reclassify potential low-scoring students as disabled, thus barring them from taking the tests. Teachers can cheat outright by changing test answers or throwing away poor performers' tests. Lower-level police officers will be penalized for an increase in reported crime, that creates pressures for fudging the numbers. In 2001, President George W. Bush passed the No Child Left Behind Act (NCLB) to address the achievement gap in school performance among different demographic groups. Schools with underperforming students faced penalties. Even though NCLB passed with bipartisan support, it failed black students, who lagged behind other groups by 2009. Sometimes the metric of success is the number and size of the reports generated, as if nothing is accomplished unless it is extensively documented. From the early 1970s to 2008, test scores remained basically unchanged on national exams, such as the National Assessment of Educational Progress tests for English and math. Disparity in education persists today. In 2015, Obama also tried his own version of NCLB with the Every Student Succeeds Act, yet achievement gaps still separate various ethnic groups. Mismeasurement in medicine. Estimates suggest that health care costs are likely to constitute 20.1% of the U.S. economy by 2025, they were 17.5% in 2014. The Affordable Care Act increased the government's share of health care expenses and lessened individual Americans' financial burdens. The law was also intended to control costs, reduce hospital readmissions, gauge the performance of doctors and hospitals, and more. Governmental and private insurers have lowered physician reimbursement rates and pressured doctors and hospitals to adopt electronic record-keeping. According to the World Health Organization (WHO), which administers a global system that uses metrics to rank medical care, the United States is in 37th place, despite being first in per capita health care spending. The U.S. ranks 39th in infant mortality, 42nd and 43rd in adult male and female mortality, respectively, and 36th in life expectancy. Information is never free, and often it is expensive in ways that rarely occur to those who demand more of it. However, doctor and health care specialist Scott W. Atlas says the numbers are ambiguous because they lack context. Actual health care quality makes up only 1/4 of the WHO's scale, another 25% measures health distribution and 25% more accounts for financial fairness, meaning everyone pays the same proportion of his or her income for health care. Culture and lifestyle contribute to mortality. Americans' sedentary routines and poor diets lead to chronic diseases such as obesity, type 2 diabetes, heart disease and others. Americans are also more likely than those in many other places to die from gun violence. When education becomes focused instead on developing the student's performance on the test no longer measures what it was created to evaluate. Pay for performance arrangements risk generating faulty metrics. With P4P, doctors receive compensation for hitting certain performance targets, such as following checklists, cutting costs or improving health outcomes. Ranking systems and P4P do not change outcomes and can spur physicians, especially surgeons, to game the system by accepting only low-risk patients. Value-added testing, which measures the changes in student performance from year to year, has real utility. It has helped to pinpoint poorly performing teachers, who have then left the system. Yet metrics can sometimes prove truly useful. When researchers measured medical outcomes for patients with central lines, thin catheters that doctors and nurses insert through patients' necks or chests to deliver medicine, nutrients and fluids, they found that almost 32,000 people died in 2001 due to central line-related blood infections. A Johns Hopkins University Hospital critical care specialist created a 5-point checklist to reduce central line infections. He tested it and generated a 66% reduction in bloodstream infections, saving thousands of lives and millions of dollars. Providers meet monthly to discuss their data, which they distribute to administrators to help everyone learn from mistakes. Mismeasurement in business and philanthropy. A P4P strategy can be useful for routine, mechanical jobs, but research suggests that companies should not pay CEOs and other top executives for performance. Using P4P leads to imperfect measurements, a decrease in creativity and the propensity to cook the books. Also, P4P may replace an executive's long-term intrinsic motivation with short-term extrinsic incentives. Privacy is being eroded both through technology, the Internet, and a culture that proclaims the virtue of candor while dismissing the need for shame. The 2008 financial crisis showed what happens when analysts substitute metrics for judgment and experience. Financial companies grew larger by adding layers of management. Leaders who weren't experts in their fields turned to metrics. Historically, customers obtained mortgages through banks, which demanded that consumers show a certain income level in order to qualify. Laws started changing in 2000, and by 2008, mortgage brokerage firms could sell mortgages as intermediaries between lenders and borrowers. The brokers earned money on volume, so they didn't care whether the customers could afford to pay their mortgages. Mortgage loan originators, such as Countrywide, packaged loans into groups of 1,000 and sold them to banks, such as Lehman Brothers, whose top executives earned performance bonuses. Eventually, the inability of many homebuyers to pay their mortgages destabilized the financial industry. Sunlight is the best disinfectant has become the credo of the new faith of WikiLeaksism, the belief that making public the internal deliberations of all organizations and governments will make the world a better place. But more often, the result is paralysis. Like businesses, charities and nonprofit organizations face pressure from donors to be transparent and accountable. Charities publish how much of their budgets they devote to administrative costs. But, lower overhead expenses don't necessarily mean the charity creates more programs or is more effective at its philanthropic mission. Managing a nonprofit requires investing in quality employees and computer systems to avoid inefficiency and high turnover. A checklist. A metric fixation can displace goals, in that people focus less on important targets than on great numbers. A narrow concentration on measuring can promote short-term thinking at the expense of long-term aims. It can drain workers' time, reward luck, degrade the work ethic, cost money, and encourage cheating while discouraging risk-taking, cooperation and common purpose. To ensure that your metrics have meaning, ask these questions. What kind of information are you thinking of measuring? If what you're gauging involves reward and punishment, consider how that could skew your results. How useful is the information? What do you plan to do with it, and how worthwhile is measuring it? How useful are more metrics? Numbers can identify outliers, such as poor performers, but they seldom can differentiate between good and great. What are the costs of not relying upon standardized measurement? Perhaps personal judgment and experience can replace or outweigh statistics. Orders for more metrics often come from new CEOs or other executives who don't know yet how their organizations function. To what purposes will the measurement be put? Metrics may be more helpful for employees than for customers or constituents who lack context. What are the costs of acquiring the metrics? Collecting and analyzing data takes time and effort. How and by whom are the measures of performance developed? Metrics should develop internally, from the bottom up. What gets measured is what gets attention. In addition, people should recognize that even the best designed metrics have limitations and that measuring can't solve every problem.
This audiobook recording is exclusive for this YouTube channel. Don't forget to subscribe and hit the notification button so you'll get updated on our next upload. If you liked the content of this audiobook, press the thumbs up button and say it in the comments below. Do you want to listen to a summary of a book we haven't covered in the past? Say it in the comments or send us an email. Check our other uploads, and as always, enjoy learning.